Thank you everyone for joining us on your Sunday afternoon for the County of San Diego's Youth Town Hall on homelessness and the housing crisis. My name is Sunny and I am joined today by my colleagues Anne and Sheila. We are all youth leaders with the County of San Diego. We would like to give honorable mention to Augustin Dow, who helped us get started on this project, but has since taken a new role in a different county department. Go to the next slide. Here we are. We started working together in the summer of 2023 for the Youth Leader program and have since undergone mentorships and weekly educational and professional development meetings. But this town hall is the capstone of our time as youth leaders. The Youth Leadership program was created under the Department of Health and Human Services and within Live Well San Diego's youth sector with the goal of developing and uplifting youth perspectives so that we could better advocate for the needs of youth.
After sorting through the many issues that affect us, this year's cohort decided to focus on mental health awareness and the housing and homelessness crisis. If you're interested in hearing more about mental health concerns of youth, the other half of our cohort will be presenting that on Saturday, January 13th from 2:30 to 4:30 p.m. at Mira Mesa Public Library and on Zoom. But as a team, we've honed in on the struggles of the unhoused and the conditions of the housing market that cause them. And today we've gathered some incredible community leaders who will help us understand the situation, what is being done about it, and what the future of housing and homelessness could look like.
So before we get started, I just want to go over a couple of our goals for the town hall. Our first goal is to educate youth and the San Diego population on the housing crisis. We also want to ensure that attendees have a nuanced understanding of the various causes, inequities, current and future solutions of the housing crisis. And we also hope to inspire more youth and people to get involved with addressing the housing crisis. So thank you so much, all of you, for being here today. Oh, sorry. We're going to move on to our agenda for the town hall. So we're first going to cover the housing crisis definition and the contributing causes, the inequities associated with housing, the effects of unstable housing on youth specifically, the proposed solutions, and then we're also going to get into a panel with our three experts, and these include Jimmy Figueroa, who led the charge in North County to provide shelter and counseling to the unhoused community, Jacqueline McLean, who is the Chief of Agency Operations at the county in the Department of Homeless Solutions and Equitable Communities, and directs the plans and programs of our county. Last but not least, we have Kia Pollard, who works with Jewish Family Services, one of the forefront organizations advocating on behalf of the unhoused as its Director of Economic Mobility and Opportunity. And then we're going to cover some resources and contact information.
We'll set aside time for questions at the end, but as we go, feel free to pop questions in the chat and get the discussion going. Also, if you see or hear something you like, you can use the Zoom reactions or send a comment in the chat. Hopefully we'll present a lot of information today that is interesting and insightful, and we want you to come away with a lot of gems. We have a busy 2 hours to get through, so let's go ahead and get started by breaking down the problem. Okay, what is the housing crisis? The housing crisis is a term used to describe the widening gap between available housing, population growth, and income, causing populations to struggle to afford and access safe, quality housing. Next slide. What the problem looks like. So 30% of all unhoused people in the United States reside in California. This is over 171,000 people. In those 171,000, more than 10,264 individuals experience homelessness in San Diego, 5,171 people unsheltered, and 5,093 people in shelters and transitional housing. Some other facts about the housing crisis are that homelessness increased by 79% in 2020. And because of this, homelessness is seen as a public health crisis with within the county, severely inhibiting individuals' access to quality care, which 40% of the unhoused population in San Diego struggle with a form of mental illness without access to the sufficient care. Now we will be moving on to the key causes economically. There are many different causes contributing to the housing crisis, one of which is economic factors being the most significant cause to the housing crisis. We see this as the San Diego County has been identified as the most expensive city in the US, having the rent cost average being $2,168 and $3,614 in 2024 due to limited land availability and high demand, high utilities, property taxes, state taxes, and the sunshine tax, because San Diego has a good climate and is close to the beach. San Diego has only continued to get more expensive, caused by and causing inflation, loss and decrease of income, discrimination, low credit scores, healthcare costs, family considerations, criminalization, and more. According to a study conducted by the San Diego Foundation, 38% spend more than the recommended maximum of 30% of their income on housing. Twice as many Latino/Latina San Diegans live below the self-sufficiency wage as their white neighbors. Approximately, which is 11% of the San Diegan population, live below the federal poverty line. The poverty line being 24,860 or less annually for a family of four. This includes nearly 86,000 children, enough to fill Petco Park twice, and housing and food costs went up 46% since the pandemic, contributing to the struggle to afford living costs with a lower wage. Another key factor contributing to the housing crisis is the lack of affordable housing. For San Diego, 171,000 housing units are needed, 23 of which need to be extremely low income. Compared to other regions and counties, there is no access to permanent supportive housing in some of the San Diego County, caused by the long amount of time and money to successfully create affordable housing, but immediate solutions are needed, further prevented by requirements and regulations restricting the building of affordable housing, making it almost impossible to create large units of affordable housing. This also includes that 75% of land zoned for housing is for single-family homes, and policies are in place making it illegal to build apartments in these neighborhoods. Another reason for the lack of affordable housing is that public opinion has limited the expansion of affordable housing and its efforts.
Now to get into inequities with housing instability. Housing instability is more prevalent in marginalized groups, and affordable housing and houselessness programs are vastly underfunded. Land use and zoning policies exclude affordable housing and create racial and economic housing segregation, as well as high cost of living, inadequate wages, and wealth and income inequality that continue to be at the root of the housing crisis. According to the San Diego Housing Commission, home ownership rates among Black and Latina households are significantly lower than white and Asian households in the city of San Diego. White and Asian households sit above 50% at around 54% home ownership rates, while Latino households sit at about 35% home ownership rates, and Black households sit at about 29% home ownership rates. This is significant because homeownership is an asset that is harder for some racial groups to obtain and sustain. Homeownership provides households an asset that grows in value, can help pay educational expenses, may be used to help family members buy their own homes, or provides an inheritance for the next generation. According to a Federal Reserve bulletin based on this survey of consumer finances, the median federal net worth of Black families is $24,000 annually. For Hispanic families, it is $36,000 annually, and for white families, it is $188,000 annually. This adds up to the average white family's federal net worth being approximately 5 times higher than Hispanic families, and nearly 8 times higher than a Black family's. The California statewide study of people experiencing homelessness by UCSF Benioff Homelessness and Housing Initiative surveyed nearly 3,200 unhoused people in California from October to November of 2022 and found a high prevalence of physical and mental disability. In regards to physical disabilities, 60% reported a chronic disease, 34% reported a limitation in daily activities, 22% reported mobility limitation, and in regards to mental disabilities, 82% reported a period in their life where they experienced a serious mental health condition, where 27% have been hospitalized for a mental health condition, and 56% of these hospitalizations, so over half, occurred prior to their first instance of homelessness. In a study posted by the UCLA Williams Institute School of Law, and in regards to inequities regarding LGBTQ plus people in housing, sexual minority adults are 2 times as likely as the general population to have experienced homelessness in their lifetime. And this is an intersectional issue because among sexual minority adults, racial minorities such as African American respondents had significantly higher rates of recent housing instability. On top of being LGBTQ plus youth have really high rates of housing instability. 20% of sexual minorities experience homelessness before the age of 18. In California, approximately 25% of youth in schools who report forms of unstable housing are LGBT. Nationally, one study estimated that 22% of youth experiencing homelessness across 22 US counties are lesbian, gay, or bisexual, meaning that the ratio of youth facing unstable housing that are LGBTQ+ is consistently about 1 out of 4 statewide and nationwide.
So now we're just going to talk a bit more about the overall youth housing crisis. Youth make up about 8% of the county's unsheltered homeless population. Approximately 50% of the chronically homeless population experienced homelessness as youth, and more than 25% surveyed in the county said that they first became homeless before the age of 25. Foster youth are also disproportionately affected, with 31 to 46% facing homelessness by age 26. So this definitely points to a serious issue that can affect youth and continue to affect them as they grow up into adults. There are, thankfully, a lot of very good resources available for youth who are experiencing housing insecurity, including the Sunburst Housing Project, which primarily focuses on LGBTQ plus youth, the SD Youth Services, and YMCA Housing Services. So we'll talk also more about these resources at the end of the town hall. So now I'm going to get into a bit more about the current solutions that are being worked on to address the housing crisis. It's important to note that there are very specific key drivers that the county is currently using and other organizations to guide these solutions. And these key drivers include making sure that solutions are person-centered, data-centered, collaboration-centered, sustainable, and also focused around equity. So there's 4 different categories of solutions. I'm going to be getting into each one, describing what they mean, the current things that fall under that factor, and also, yes, the available initiatives and organizations that are currently working on that solution. So our first factor of the solution plan is root cause and upstream prevention. There's $704.1 million being allocated to support the root cause and upstream prevention aspect of the solution plan. And this consists of employment and income support programs. It also focuses on ensuring that people have access to basic social services and community empowerment activities. In San Diego, 32 new people have been hired to expand direct outreach and case management services for individuals experiencing housing insecurity, and they are enhancing existing services in the central and south parts of the county. Additionally, new staff is being deployed this month in North County and next month in East County to help support these efforts further. This particular strategy in the solution plan is focused on establishing a person-centered system, and it uses a housing-first approach and maximizes social services interactions with people. These initiatives also follow evidence-based and data-driven solutions. Comprehensive data analysis ensures that homeless people experiencing housing insecurity, these prevention and response initiatives are done with racial and social equity. Moving on to our next factor of the solution, diversion and mitigation. 77 million has been allocated to support this aspect of the solution plan, and this strategy is intended to ensure that homelessness, the experience is as brief as possible. Initiatives associated under this factor prevent unsheltered homelessness and repeated stays in shelters, and it also helps to reserve shelter space and shortens wait lists for those without other options. This strategy also helps people at risk of experiencing housing insecurity retain their current permanent housing through supportive services. And one of these services is organized by the SDHC Partnership Program within the city of San Diego. It assists new individuals and families receive help identifying housing options to avoid entering the shelter system. And this solution strategy helps to reduce the number of people experiencing homelessness and the demand for temporary shelter beds. Some other aspects of this solution include short-term case management, housing search assistance, temporary rental assistance, financial assistance as well. So moving on, another factor of the solution plan is services, treatment, and outreach. 178.9 million has been allocated to support this aspect of the solution plan. An example of one of these service initiatives is the PATH program, which organizes outreach and engagement to persons who would otherwise not receive services due to the combined conditions of homelessness and serious mental illness. PATH programs connect individuals with existing mainstream mental health, substance use, housing, and other programs. They also provide other services and support, including primary service referrals, outreach, habilitation and rehabilitation, community mental health, alcohol drug treatment, staff training, referrals for primary health care, and general housing services as well. And yeah, I see in the chat a lot of people are talking about having access to the slides after. Definitely will be sure to provide access after the town hall. Moving on, we're going to cover permanent housing and support, which is another aspect of the solution plan. 235.2 million has been allocated to support this. This strategy assists people with obtaining permanent housing, which is obviously a very important part of addressing the housing crisis. Some interventions and initiatives that are utilized to secure this goal include affordable housing assistance with voluntary support services to address the needs of people experiencing chronic homelessness, services designed to build independent living skills, support systems that connect people with community-based healthcare, treatment, and employment services to ensure that they can escape the cycle of housing insecurity. So moving on, we're going to talk a little bit more about some future solutions that are being worked on, kind of beyond what we've already discussed. So more future solutions to the crisis include increasing permanent affordable housing, which we talked a little bit about before. There are many different aspects to accomplishing this. Professionals are discussing more housing construction in multifamily and commercial areas served by public transit. We also need to remove regulatory barriers to housing, such as laws preventing the building of apartments in specific neighborhoods, to be able to make use of land for affordable housing without extensive zoning barriers. There's also a low-income housing tax credit program, which awards tax credits to housing developers for ensuring that a portion of property units is set aside for lower income households. So this extra incentive can help increase the amount of affordable housing that's available for different populations. Guaranteed basic income is another legislative program that seeks to provide monthly income payments to individuals, thereby helping to address and break the cycle of poverty. Multiple pilots of this program have been conducted in the US, and I think are still currently being conducted as well. Professionals are also aiming to increase accessibility to resources and restorative practices for those experiencing housing insecurity. They want to increase community amenities, including parks, gyms, recreational centers, bathrooms, to support individuals' well being and health. And they also want to increase access to healthcare, educational, and professional services for individuals who are transitioning out of homelessness. Okay, so now we're going to be getting into our panel. We're going to be engaging in a discussion with our three experts who all have very direct experience in the field of housing insecurity to get their perspectives on the issue, the effectiveness of current solutions, and also their hopes for the future.
Now I will be introducing Jacqueline McLean, who is the Chief of Agency of Operations in the County of San Diego. A question for you, Jacqueline. What do you do in this role, and why did you get involved in addressing the housing crisis?
Hi, good afternoon, everybody. Thank you. It was a lot of information, and having worked in this field for a long time, I know there's information everywhere. So thank you for consolidating it and providing that platform for today. So I'm relatively new to San Diego, to the County of San Diego. I spent most of I'm actually from New Zealand, and I guess my interest started in this field through mental health. Specifically, my dad actually managed psychiatric hospitals in New Zealand, and I lived in all the psychiatric hospitals in the North Island of New Zealand. So when I moved to America, I moved to Seattle, and that's the place that I really started working in mental health and ended up running that system for the King County in Washington State. At that time, I was a little more involved in more generic human services. So the county up there is structured a little differently. So there are less departments and so more consolidated. So I oversaw all of the human services. So it was a really good opportunity to have under my umbrella everything from homelessness to housing to social services programs that the county managed. It was so small departments. I also managed the Office of the Public Defender because nobody wanted to do it. So I ended up with it. So I had this very eclectic background of understanding of what it takes to be a vulnerable population and the kinds of services that folks need. I moved down the coast to Santa Clara County and went back into mental health and housing at a department there. And then when I moved to San Diego, I sort of filled a gap. I came the beginning. I thought I was coming the middle of COVID, but it was the very beginning of COVID, and filled a gap where people were leaving or not in the office, and started working really more specifically in homelessness. And in 2021, the county adopted a new department, the Office of Homeless Solutions and Equitable Communities. And the work I was doing was absorbed into one of the three offices in there. So our office, the department that I work under is the Department of Homeless Solutions and Equitable Communities. And there are three offices in it. One is the Office of Equitable Communities, one is the Office of Immigrant and Refugee Affairs, and the other is the Office of Homeless Solutions. And we work and have really been trying hard to work across the county with all our other sister departments and programs to really coordinate access to services and the types of programs that we are able to provide for people that are experiencing homelessness. Thank you.
Thank you, Jacqueline. Now we'll be moving to the next slide.
All right, now we would like to introduce Kia Pollard, who is the Director of Economic Mobility and Opportunity at the Jewish Family Service of San Diego. Kia, I would love to ask you a little bit more about your background, what you do in this position, and kind of why you got involved in this role.
Absolutely. Thank you. It's first, I just have to say it's such an honor to be here. It's really a deep pleasure. I am very much interested in youth and youth power and engaging youth, because you all inherit what we do today, and will be the ones to bring it to fruition in the future. That's been part of my path for quite some time, both at the County of San Diego. I worked there, gosh, when did I start? 2016, 2015, somewhere in there. And I spent a little over 6 years there as a Health and Human Services Policy Advisor for an elected official at the county. And then I left during the COVID year, during 2020, the end of it. So I got to see some of that transformation around regional response to the pandemic, really, and assist with that, which was very eye-opening and actually confronting on several fronts, which I'll get to in a second. But from there, I had the fortune of working nationally, an organization called the National Association of Counties, which serves hundreds of counties all across the country. And I was specifically working with counties on justice-related interventions and innovation, really innovating with the resources within the county to create new structures that support the needs in the community in very adaptive and flexible ways. So all of that was driven, I think, by my desire to really build a community that works for everyone, youth included, families included, people of color, Black people, vulnerable communities. And that carries over into sort of my personal passions, which include my coffee shop, which is a cooperative coffee shop in San Diego County called Cafe X. And I think part of this is bringing me back around to my focus on economic mobility and the impetus for creating a foundation like a cooperative that would really bridge the gap between government, between businesses, between nonprofits, to create the social safety net that we all need and need now more than ever. So my role there at the coffee shop, founding it and building it, very much ties into the work I do at Jewish Family Service with guaranteed income. And my desire to make sure that there is a foundation, a net for all people who need it, to be able to meet their basic needs, but not only that, use that and mobilize into the future. You know, it's one goal to create stability, and it's a whole nother to help people create a vision for their life and empower them to do that. So that's what I think about when I think about, you know, all my work leading toward what is this grand vision of economic mobility and true opportunity in San Diego County. So that's a little bit about me, but I think personally I'm driven to do this work because I was somebody who did not have, I was a youth that experienced housing instability in multiple different ways. I'm not too far removed from that, okay? I'm older, but I carry those memories, and the work I do with my family and with community is really reflective of the things that I care about. So I like to build things to make my communities better.
Thank you so much for sharing, Kia. That was great to hear about your background and where you're coming from and how that's kind of added to your current role. So I appreciate that. We can now introduce our next speaker, who has not hopped on the call yet, but we will introduce him regardless.
Yeah, so I'll just be introducing our third panelist, Jimmy Figueroa, who is the Executive Director of Operation Hope in North County. I think he actually had another meeting he had to attend before this, so I think he'll be hopping on a bit later. So I think we can start with our questions for the other panelists first. I think we can start with the next slide, but yeah, we'll come back to this one later. Thank you. Okay, so we're going to start with some questions for Jacqueline McLean. The county approach to housing and homelessness revolves around 5 points, according to the Housing Action Plan, which I covered previously in our presentation. So we just wanted to talk a bit more about what has worked with this approach and if there are any barriers that you've come across to these current solutions that are being worked towards.
So this is a really big topic. The diagram that you showed a little bit before that had the key drivers and the strategic initiatives on it is a framework that was adopted by the Board of Supervisors in 2 years ago, just over 2 years ago. And we have spent some time categorizing all the county's homeless programs, all the programs that directly focused on serving people experiencing homelessness, or are programs that are generic programs, but by chance or by whatever serve a percentage of people that are also homeless. We have about 85 programs in that part, and we did list some other resources that are associated with them. And the total currently, that this is only the county. Remember, we are one entity in this in the county of San Diego, and we put about $1.4 billion into that program. More than half of that, about 800,000, is through self-sufficiency benefits. So things like general relief and food stamps and CalWorks and those kind of programs. So money we get from the state and pass through to individuals. But the rest is really money that the county has devoted towards different programs to end homelessness. I think that where we're up to, and our final plan is about to be published. It's not completely done yet. We're still working on some final nuances to make sure people really understand it, and we have our accountability measures in there. We are in the process of pulling together a dashboard that will measure the progress in the plan. The plan has different elements that we have put as markers of success, and we will be reporting those on a regular basis. So as far as specifically the plan we've designed and the work we've done, we're almost ready with our final project and to start publishing our measuring on that. With regard to, I think, just one other point on the piece you say about how are we doing. It's the world of homelessness, and I'm sure the researchers here have found out it's real definitions are a real challenge. Everybody defines homelessness or their touch on homelessness or the act of homelessness different. And I'll give you an example. The school district calls folks that are couch surfing homeless. We do not. So there are discrepancies in the way we count, the way we look at people, the way we provide services. So trying to get common outcomes and trying to get common measures is quite the challenge to make, and also trying to distill it so that folks don't get lost in the bureaucratic nuances. So those are things that we are working. One last answer, what we have specifically seen success with, and you mentioned this, I think one of the questions later on is related to this, is the county's outreach teams moving people off the streets, and that we have expanded services and provide services countywide, and those services make sure people have access to the benefits that they're eligible for, particularly the cash and food benefits and healthcare benefits, and then really try to work with them to move them off the streets and into more stable housing. So that's probably one of our successes that we share at the moment. And I know, and on the top of my head, I know because I was looking at the numbers the other day. So far this year, we have made um, more than 35,000 contacts with people. So that's not unduplicated. So it may be multiple contacts with the same person, but our staff has been in touch with people 35,000 times, and we're expecting to be over 50,000 by the end of June. So we really are out there connecting with people and working with them and reconnecting, as the case may be, to support them moving from the streets. I'll add one thing, sorry, before I finish. Something that we have been really lucky to do is have access to flexible funding. The Board of Supervisors provided us with that funding at the end of last year. And it's funding that helps people remove their barriers when you have barriers down here. And so many funding sources come with strings attached, so that, you know, this funding source can't buy shoes, that funding source can't buy documents, this funding source can't buy the house. Our flexible funding is totally open to removing barriers for people's placement in housing. So we do something like help with credit repair, help with documents. We can back pay electricity, outstanding electro utility costs. We can even get car repairs. So we have, we try to be judicious about how we expand the funds and make sure that it really is to reduce barriers to people becoming more stably housed. But that has been an amazing pot of money for us to have access to, and a good solution.
That's awesome. Thank you, Jacqueline, for sharing that and letting us kind of see into how that money is spent within the county on housing resources.
Mm-hmm.
Go on to next. Thank you. All right. So these are for Kia. Could you tell us a little bit more about what is narrative change and why does that matter?
I'm on mute. I absolutely can. I think in order to do that, I'm going to work a little backwards.
Okay, so so we can switch it around. So could you tell us a bit more about what is basic income and guaranteed income programs then?
Absolutely. Yeah, I got you. Yeah, basic income is, I mean, it has such a meaningful history. Not only in this country, at this time, there are over 100 pilots in North America, but there are about 20 or so globally, places like the UK, India, China, Kenya. So folks are experimenting with the idea of providing income that is directly paid to people. And I mean, the demographics of those people vary, and there is still quite a bit of conversation about what is guaranteed income versus basic income, and UBI is a different thing. UBI is universal basic income for all people in a nation or in a jurisdiction. Guaranteed income and basic income, I use interchangeably for the work that I specifically do, which I'll talk about in a second, our programs. Basic guaranteed income is very specific and targeted to populations that really are most vulnerable. So families that are low income, families of color. Our programs look at zip code as well and the concentrations of low income people of color in these zip codes and all of the other intersecting factors like food insecurity, environmental stressors, unemployment. All of these things are indicators that told us that these are the populations that we need to be working with for our program. So circling back to the question about what is guaranteed income and basic income, it's really a concept that has evolved over time. I mean, some people trace it back to Thomas Paine and Common Sense in the pamphlet that he wrote that argued for some sort of basic income for community, it would be more akin to UBI, universal, to cover basic needs. There have been people like Andrew Yang, most recently, I think it was 2020, where his campaign platform was UBI was part of that. Providing that universal basic income to all Americans was his thing. But even before him, there was a really transformative period that is really meaningful for me personally within the Black Power movement. The Black Panthers, Martin Luther King is the most popular, but he learned it from Black mothers fighting to transform the welfare system as they knew it back in the 60s. Without going into a rabbit hole on the welfare system, it was racist, like a lot of things in those days. And these are things we're still trying to overcome structurally with how benefits are administered, the ways in which they're restricted and categorical. Now that there's no explicit racism happening, right? We still have things de facto happening in practice that excluded people. For example, domestic workers back in the 30s could not get a Social Security is what it was known then. They could not access it. And these were administrative barriers to people getting the income that they needed to survive. And this was all part of the social safety net, the New Deal of the time. And so was TANF, which is really, when we say welfare, that's what it is. Temporary assistance for needy families from the 90s. So lots of history. I say all that to say people were excluded. Agricultural, domestic workers were excluded. About 90% of those people were Black. And so I think it's really important to think about guaranteed income and basic income with that context in mind, and not only transforming the system as it exists, because it's hard to access those benefits in certain circumstances. It is demeaning in a lot of cases where people have to recertify and prove that they still are poor, right? And all of these things that come with that, it's the ideology that we're shifting when we talk about guaranteed income. So guaranteed income itself, providing for basic needs on a consistent basis. This is money, income that families or whatever population that you're choosing to focus on when you provide this type of support, it's support that they can count on monthly, so our programs, this kind of directs me to our programs and the ones that I administer through JFS. They target low-income families of color. That was our first pilot, called the San Diego for Every Child Guaranteed Income Pilot. We work with 150 families in 4 zip codes of San Diego, National City, Paradise Hill, San Ysidro, the southeastern San Diego area, right? So we targeted these communities for the indicators that I mentioned before. We know that these conflating indicators mean that there is a long history of disenfranchisement. And so through this program, we provide $500 a month for 2 years, just 24 months, and it's unrestricted. Families can spend it on whatever they feel their family needs, whether that be school supplies, a new pair of shoes, food, anything. They are able to choose and really have the dignity of choosing. And those principles are very important, and I might circle back to those later. But that's one program. And we are almost through with that program too, which I know I'll get to talk about a little bit more. That's program number 1. We started that in 2021 and are nearly toward the end of it next month, actually. So the next program we started was the Recovery Action Fund for Tomorrow. And that program provides $4,000 a month to about where we just ended the program, and we ended up serving 2,242 people. Our goal was 2,250, so we were 8 short, but very close, very close. And the whole point was to provide emergency assistance one time that families could use on whatever they needed. And within the patchwork of guaranteed income and direct cash assistance programs, because they are kind of cousins, they kind of work together. As was mentioned earlier by Jacqueline, there's so many connected pieces to solving a housing crisis or any crisis, just meeting basic needs. So this acts as like a one-time stopgap for people who do need that big infusion of cash to pay for back rent, to prevent homelessness, and things that we know money can do so that the problem does not worsen. So that's RAFT. And then I have one more, one more program that we're in partnership with the County of San Diego, just like RAFT is also a partnership with the County of San Diego. The Family Income for Empowerment Program, FEEP, also known as FEEP, is our second guaranteed income program, providing the monthly cash to families for 2 years as well. But this demographic are families who have been referred to child welfare services. Now child and family well-being. So there's a name change countywide for that department, but families who have been referred for general neglect, emotional or physical abuse, and have a high likelihood of returning and being investigated for that in the future. So our goal is to use cash as a preventative measure to stop that cycle of entry into the system, because we know that general neglect is a lot of people just don't have money. They don't have money to provide for basic needs like food, or that medical appointment that that child might need, going to the dentist and things like that, that folks are being investigated for because they're going to school, their peers are seeing it, or their mandated reporters are seeing it, right? So we're saying, okay, instead of sending that family through to child welfare services, let's see what we can provide on the front end so that we don't, end up traumatizing that family further, frankly, and seeing what we can do to empower them and help them utilize money to support their family however they need to do that. So we have a lot going on, but hopefully that's helpful to give you a picture of what work we do and a little bit about why we do it. And I'll just say kind of quickly, because I see this other question, these narrative change questions, and also how can it work to solve homelessness? Oh, there's so many ways. I'll just say, I'll kind of work my way backwards to narrative change because it's one really important pillar, but naturally, when we think about homelessness, we think about people who don't have a lot of resources to not only maintain a home, but actually fill a home, with the things that are needed, whether that be food or just furniture, right? So there's a real absence of concrete supports when we think about families who are experiencing homelessness. And that could be chronic homelessness. So they are homeless for a long period of time. Or it could be transitional or temporary, right? And that's actually the largest category of people. That's the category I was in, when I was younger, and what my family experienced is that temporary homelessness because of some financial shock, someone losing a job and, having to find new housing because of that, because we can't make rent. Some small setback that really, if we just had some extra money, we would be able to ride that out and withstand that volatility, right, in the market. So if we think about providing people income to meet that need, and the amount can vary for our programs. You heard I mentioned $500 a month. Now, we know that's not paying rent in San Diego, right? Like those programs that are giving $500, it might help to put some of that towards rent. But what we're seeing people pay for with that amount of money is food, housing supplies, like retail is the second largest category of people who are on our programs. And then the third is transportation. So I say that to say the program design is going to have to cater to the outcomes, right? So the other program, RAFT, $4,000 a month, we're seeing people pay that rent, that back rent, and then pay forward, the amount required to maintain housing. So it's a huge potential to utilize a flexible source of income like guaranteed income on housing outcomes. And we're seeing that with other programs. You know, there are programs that I'm not going to go into too much detail about, but Denver has a program that's working specifically with unsheltered individuals. Philadelphia has a program that's working with homeless individuals and a mixture of people at risk of experiencing homelessness. So another program in DC, and all of those programs are being evaluated. And the results actually are not even available yet, but there are some preliminary findings that we already know and we expect to see, right? When you give people money, they spend it on what they need. And a lot of the times that's housing nationally. It's a national issue. So there, I have so much more to say, but it's a natural fit, and why it's encouraging to be on this panel and also see the conversation broadening about how support is provided. You know, we can provide it in a way that is directly impacting the family and building trust and saying, hey, we trust you and we give you the dignity to spend that money however you see fit for your family. You know, it's a different relationship that we're building with the people that we work with. And that's long-term sustainability, right? Helping people solve their own problems. And part of that is making sure that they can tell their story in a way that influences public policy. So it's cathartic to tell a story, and sometimes people actually get fatigued telling their story, right? So being mindful of that and gathering narratives in all of our programs that really impact the way that people not only view the family, but the opportunity to change the welfare system, or cash benefits as we know it, and making that, really building that into the program. So we have cohorts of families in our programs that are volunteering, and we pay them because we believe in that, to share their story. And to the extent that they share it, and we can collectively devise meaningful action as a result of their share, right? So it's not just the income itself, but it's changing the opinion about doing this work in this way that makes it incredibly powerful as a policy solution. So I think I covered all the questions. I'm sorry if I went a little long, but there's just, I mean, I get so much joy from working through all of these complex pieces of administering these types of programs, because it really, I strongly believe this is the future.
Thank you so much, Kia. Your passion for this topic is evident, and I think we got a lot of great information from you. So thank you so much. Jacqueline, did you have some more to add?
Yeah, I just wanted to piggyback on that a little bit about the narrative change. There's a group in San Diego called Funders Together to End Homelessness San Diego, and it's kind of a conglomeration of a number of philanthropies. So this is private funding from people that have money and would like to spend it on addressing homelessness issues. And year before, gosh, I want to say 2 years ago now. A week ago, I would have said last year. Now it's 2 years ago. They did a campaign that was related. They called it the Narrative Change Campaign. That's why it's sort of, I'm piggybacking on this piece. And what they did was they looked at social media, and it was a social media campaign. It was very clever. It was through Twitter and Facebook and Instagram, I believe. And they looked at the way people talk about the solutions to homelessness, and found that the answer was all over the map. And we've all heard it. It's because they're mentally ill. It's because they don't want to be homeless. It's because. And there was no one focus on the answer to that question. And they tried to make the answer very simple. The solution to homelessness is housing. And that was it. So on their website, so they did this campaign, they did an inventory, they produced a white paper, they did some training, and it tried to implement this narrative change and called people on the carpet, called prominent people who were always in the news on the way they worded this solutions to homelessness. So I believe the information is on their website, Funders Together to End Homelessness. So it was very interesting.
Very cool. And I hope that this conversation that we're having and with our panelists inspires some of our audience to kind of have more of these conversations with people they know. With that, we have some more questions. Pass it on to Anne.
So this next question is for Jacqueline McLean. What are the roles of the city/county/regional task force on homelessness in addressing the housing crisis? How is the work distributed, and how do these organizations work together?
I just want to acknowledge I got all the boring questions. So, so I'm sorry to the audience. So there are, let me start, Regional Task Force on Homelessness. So the federal government recognizes entities called continuums of care. It has mandated that every community has a continuum of care. And so that's a vehicle that works with the federal government, provides certain information to the federal government, and undertakes certain responsibilities in a community. In our community, that entity is the Regional Task Force on Homelessness. In other communities, for example, Washington, where I worked, Seattle, the city undertook that responsibility, and Santa Clara County, the county undertook that responsibility. But in this community, the Regional Task Force undertakes that responsibility. They receive money from the federal government. They distribute money. They do the point-in-time count, so the annual one-night count of unsheltered people, and report that to the federal government. They do our homeless inventory. They do a number of mandatory reporting requirements on behalf of our whole community for the federal government. And they also set policy or guidance. For example, they set the policy or drove the policy on how people get into the coordinated entry system, which is how they get prioritized for housing, subsidized housing, or actually any housing in it, primarily subsidized housing in our community. The county works with that. So the county's role is, so the city of San Diego's role is that, there are, I forget, 17 cities in the county. City of San Diego is by far the biggest, and because of its size, it is often recognized by the federal government and by the state government as an independent entity to be funded. The next biggest city is Chula Vista, and it doesn't cross the threshold to get some of these independent funding sources, but it's close. So the city is jurisdictionally based, and they take care of infrastructure and services in their city. The county is a little bit different, and it has a dual function. So where these 17 cities end, there's a lot of unincorporated land in this county. And the county of San Diego is the administrative or infrastructure government for all of those places in the county that have are not large enough or have not designated them as cities. For example, Spring Valley, Baroka Springs, all sorts of places, primarily in East County, are unincorporated, and the county provides the roads and all of those infrastructure things for those areas. The other role the county plays is that of a service provider. And there are some services that are not split up into jurisdictional bodies, and those are self-sufficiency. So all of the benefits that people are able to access, the county oversees that system. The behavioral health system, so all the mental health and substance use system, where the funding comes from federal and state government, the county oversees that. Occasionally, some of our other partners set up little independent if they have additional resources, they are able to set up independent contracts for services, but the county has the biggest pot of money in those two areas. The same with child welfare. The other cities and jurisdictions do not do child welfare services. Those are all in the county. So it plays this both regional role for a number of services and local role for infrastructure operations. Specifically for homelessness, the state government funds has a number of different funding sources for homelessness and for housing. And over the last 2 or 3 years, they have been really trying to consolidate their work and make sure the different funding streams talk to each other. So that is what our housing action plan, which this year is a joint plan that needs to be written by the City of San Diego, the Regional Task Force on Homelessness, and the county. And that is different from all the plans that we've published so far. That one will be out for public comment in February, and it's due to the state in March. And in response, for us being more coordinated, we will bring about $50 million to the county in funding for homelessness. So we are really trying to work together. Everybody has their own board of supervisors or their own council or their own funding sources that direct their work they do, but we really are working hard to coordinate them across the county together. And I think I talked about our street outreach.
Thank you, Jacqueline. Really insightful information. So our next question is for anyone on the panel to answer. The County Homeless Action Plan said that the most common way people exit homelessness is through street outreach with a 39% success rate. Does your organization do this kind of street outreach? If so, what does that process look like?
I can just reiterate that the county service is a team of outreach workers who make initial contact with people on the streets or in shelters and ensure they have access to benefits that they're entitled, funding they're entitled to. And they are followed up and access to a path off the street. We have the flexible funding, but we also try to hook people into existing programs. And for folks that need more support than just the outreach worker, we also have a team of social workers that are able to follow up with more gnarly, difficult situations for folks. And recently, it's taken us 2 years, but recently we just hired 2 licensed mental health social workers. So we have even a deeper level of backup for our people that are out in the field, for folks that need more intensive support or better linkages to other systems.
Awesome.
And we work in all of our outreach workers partner with the cities that they're working in. So Oceanside has an outreach team. We partner with them. Vista, all of the cities that have outreach teams, we work closely with them, and also with Caltrans. So that's the state transportation agency. There are a lot of people experiencing homelessness that live on right-of-ways, state right-of-ways, dead ends or freeway underpasses or on-ramps or off-ramps. And over the last year, we've really strengthened our work with them. They have some outreach teams. So generally, we go out as a group so that people aren't switching from one side of the road to the other to get out of the jurisdiction. But so that's another way that we're doing is increasing our partnerships.
Great, thank you. And I notice one of our panelists, Jimmy, has just joined. So we'd love to circle back to our first questions in our slides related to youth. And Jimmy, we would love to introduce you and hear more about what you do as the executive director of Operation Hope in North County.
Yeah, good afternoon, everyone, and thank you so much for having me. I literally was at a community meeting, a meeting with folks from our manufactured homes here in Oceanside, which is one of the last forms of affordable housing in our region, and meeting with community members on how we can help to advocate to preserve our manufactured homes. Because that is, like a lot of the issues that we're having in our community, folks are being priced out. And a lot of the folks living there are on fixed incomes from our senior community, which is one of the fastest growing folks experiencing homelessness for the first time. And so just trying to bring advocacy to preventing homelessness. And so, Operation Hope North County is a homeless shelter for families with children and single women located in Vista in North County. Last fiscal year, our number one service population area was the city of San Diego. Number two was Escondido, and number three was Oceanside. We're located in Vista, and that was where the fourth largest service population came from. But the city of San Diego being first, Escondido second, and Oceanside being third, which kind of makes sense because those are the largest cities, some of the larger areas in the entire county. With that being said, the majority of our clients tend to be single moms with children. And so what you end up having is, at the most, we have 45 beds at our shelter, 12 individual rooms, 11 of them are for 11 family rooms. What you end up seeing at our shelter, though, is children. For every single mom, there's 3 or 4 kids. And these are families in our community that have been priced out. That's mainly what we're seeing at our shelter. It's families that have been priced out and cannot afford the deposit of a new rental space. Also, because vacancy rates are so low, landlords are really taking advantage of that and asking for 2.5 times the rent, for families to come in. And so a lot of the families at our shelter, or the parents, have jobs, their kids are enrolled in our local schools, but because they don't have a livable wage based on what rental rates are at the moment, that they now need our services at the shelter. And so what we are able to do is help families stay at our shelter and provide that security for 3 to 4 months. And while they're at our shelter, we pretty much take care of all toilet. We have a laundry room, so they don't have to worry about the cost of anything related to like toiletries, laundry. We provided dinners for our families at the shelter, continental breakfast, and our program is really set up on helping families get back into housing. So part of that is residents. Part of their program plan is that they're required to have a savings plan, save 30% of their check, and if they we also have our case managers that help them. If they already have a job, how can we get them a job that pays a little bit more, or also assist with childcare? Because that's something that we've encountered as well, is that we have parents that come to us and they didn't have access to affordable childcare. So through our partnerships in the community, we're able to offer that as well. Because sometimes some of the single parents at our shelter, it's if you have a child in high school, another one in middle school, another one in elementary school, and another one that maybe is a toddler, well, those are, they're on 3 different schedules, 4 different schedules, and it's very hard for a parent to navigate employment through that as well if they're doing this by themselves. And so us having partnerships to our local Boys and Girls Club, partnering with MAC and other childcare providers, we're able to start providing an ecosystem of support for our families. But yes, what you end up seeing at our shelter is mainly children, because the majority of the adults at our shelter tend to be single moms, and it tends to be single moms of color. Black and brown moms is what we're seeing. And so we do allow, we don't define the family structure. So if it's a single dad, if it's grandparents, it doesn't matter. It's just whoever has legal custody of the children are able to stay at our shelter. It's just we just tend to see single Black and brown moms. That's what we usually that's the high percentage of folks that utilize our shelter.
Thank you so much. And we do have a few youth focused questions. And did you want
Sure.
to get into these?
Yeah, absolutely.
Can I just jump in? I'm so sorry.
Yeah.
I was so excited by hearing Jimmy because the profile, so to speak, the demographics that we're serving in our guaranteed income programs, which I don't know if I mentioned in my spiel, are all families, and our definition of family is very loose as well. The families really define what that means. But all families have to have one child, and all of them do. And they are women of color, Latinx women specifically are the highest population, and then it's Black women as well who are receiving the income on a monthly basis. So it's not coincidental. I think that the folks who are experiencing some sort of housing instability are also benefiting from our programs, and it's really I think indicative of the need. And what really kind of pulled me in to speak on this was the market, the rental market, which I'm glad Jimmy touched on as well. It's tight, to put it into really concise terms, in that landlords are and can and have the capacity to discriminate. When it comes to low income people or people of color, and there are housing voucher programs for multiple different populations in San Diego County, and Jacqueline touched on the different housing authorities and what have you, and each have the ability to distribute vouchers, which help subsidize rent for the family or the individual that has it. So they end up paying no more than 30% of their income on rent. That housing authority kicks in the other portion for that person to rent a unit from a landlord. But in that dance, you have to have landlords that don't discriminate against voucher holders, essentially. And so we find ourselves in a very interesting time where there's like a 70,000 person wait list. I heard it's about 12 years long, to get a voucher and get some sort of assistance to be able to rent in the private market. So I think this is kind of a bridge to what I really want to say, is that cash assistance and guaranteed income not only eliminate some of that scarlet lettering, I'll say, or that conspicuous nature of coming into the market with a voucher, where folks can discriminate against you, and, you know, not even counting all the other reasons why they can discriminate against you, right? But just thinking about the ability of a family to compete in a market with such a low vacancy rate, is why a lot of these programs are emerging and focusing on housing as an outcome, and really looking at housing quality regionally is one of the core pillars of some of the research and the evaluation that's coming out around guaranteed income. So thank you for sharing that and just allowing me the space to talk a little bit more about that.
I'm so sorry. Can you guys, I'm trying to look at the questions, but I'm off site right now in a parking lot. Can you guys, or can you all please provide one of the questions that you would
Of
like
course.
for me? Yeah.
Yeah, sorry about that.
No, it's okay.
I think we touched on this a little bit about like specifically what a child or a youth or a family should do if they're experiencing homelessness. But I think we just want to open it up to all our speakers as well. But what should these people do? What kind of resources are available? What's basically like the first step they should take if they start experiencing housing insecurity or homelessness?
I think one of the things that we have seen with the families at our shelter is that sometimes it's not communicated to the schools where their children are attending, because of the fear of what can happen if that information is disclosed. But at the same time, school districts are obliged to have resources there. McKinney-Vento and other, they should have homeless liaison teams as well. So once a family begins to and inquire about resources, the goal is and it varies by region. San Diego County is so large, and so I can only really speak to the North County area, because that's where we're located. There's a vast majority there. I mean, there's a lot of resources available, but as we all know, the our unsheltered community, the challenges within our unsheltered community are so complex and so vast. And it ranges from so many different ranges as far as what's causing a family to succumb to like these income instability, whether it's food insecurity or housing insecurity. I mean, there's so many things, but I think that's why it's so important to first communicate, if the child's enrolled in school, to the local schools, and hopefully that homeless liaison has the resources available to start plugging that family into an ecosystem of support, because along with all of this comes trauma. Sometimes there's DV involved, domestic violence. And so you really want to be able to provide family, if you can provide preventative resources like cash assistance. So a family, because if you can provide preventative support, it's so much more effective, and I don't want to use the word easier, but it's to prevent a family from becoming homeless versus trying to get them back into housing. It's such an uphill battle. A lot of it has to do with that deposit as well, and also the elements, if they start living out of their car, and the elements that they're being exposed to, especially as children. There's trauma associated with that as well. But in North County, we always try to promote, with our schools too, for them to be more vocal to their student bodies about the resources available at the schools, and really speak out about it, because it's really impacting our region at a high rate. I think higher rate than maybe some of our administrators are aware of, or were aware of even at the beginning of this year, because what we're seeing is families being displaced at a high proportion now. And so I think just really communicating to the schools, or for us, we have organizations like North County Lifeline, Interfaith Vista Community Clinic, that really have a footprint all throughout North County. And sometimes that's where the referrals come by. But I really think that working with the homeless liaisons within the school districts is key, because they should have access to the array of resources in that specific region.
Thank you so much for sharing on that. That's really good information for everyone to be aware of. I guess if anyone else wants to speak on this topic specifically, feel free to jump in. And if not, we can move on to our next.
I can add.
Oh, okay. Go ahead. Of
Yeah,
course.
I can add. And I think Sheila put the flyer in the chat, so it's in there. So we have a program. We had it as a pilot for 2 years, and now it's on a 5-year project called Housing Our Youth. It's overseen by the YMCA, is the contract holder, but they have subcontractors, as you can see on the flyer, of the leading youth providers in the county. And that is a program that's open access. So you don't have to go through anyone to get a referral. You don't need to be in a specific program. It's just call and contact David, and talk with them about program or accessing the program. So that's one. The second one that may be of interest, and I don't have a flyer on it yet. We have been developing this for a little bit, and the contractor just started taking people this month, actually, so it's very new. But I'm happy to provide it, or if folks can ask me for it when we get it done. And so that's a program. This is a set of 3 programs for LGBTQ plus folks, and one of them, I'll just tell you what the big picture is. A piece of that program is capacity building, so it's education for anybody, shelters, agencies, schools, anyone who would like information on how to be more affirming for people that are part of the LGBTQ plus community. And the contractor is North County LGBTQ Center, and they will do presentations with anybody that asks them about that. The second piece was enhanced services. So folks in that community often need specialty services, whether it's counseling or medical providers or pharmaceuticals or anything. And we have enhanced services at agencies for 2 years to support people in this community better access services. And the third, and as I said, that one just started up taking people this month, and the service providers for that, just see, the San Diego LGBT Community Center, North County LGBTQ Resource Center again, and Vista Community Center. And those are countywide, so anyone in the county can access those enhanced services. And then the third one, and this one is run by the center, the San Diego LGBTQ Community Center, and it has some subcontractors. And that's what we're causing innovative housing. And so again, self-referral to these agencies, and their job is to find innovative ways to either prevent people and families from who identify in the LGBTQ plus community from either becoming homelessness, or to try to resolve their homelessness in ways that may not be traditionally offered, ways that are the traditional ones that are offered. So those are some new kind of youth-focused resources that we have put in place just newly.
Thank you so much for sharing. It's really great that you were able to share a lot more information about some resources available. I see in the chat we have another question. I was wondering if anyone would be able to, I think we covered this a little bit, but I can just read it out. I don't know if, can everyone see the questions in the chat?
No, I believe this one was just to the hosts and panelists.
Oh, okay. Should we wait to answer it until like the end, or cover it now?
Let's go to our last question and then get into the questions from our participants.
Okay, yeah. So this question is to everyone again. What do you see as the ideal next steps within the next 5 years to address the housing crisis? How can we address housing and homelessness disparities effectively in the long term? So obviously this is a very loaded question. We know that there are many different ways to approach it and many different things to talk about. So we'd really just like to hear all of your individual perspectives or your thoughts. I know you've already touched on this a little bit, but yeah, if anyone would like to first share.
I can share first. I think, even the meeting that I was having right now, the manufactured home community is asking for rent control and support with rent control, amongst their properties. They own the mobile park. They own their mobile home, their manufactured home, but they are paying rent on the land that it sits on. And what we're seeing is, again, in that community as well, along with our, apartment complexes, is the rise of rent. And so the bringing policies that can protect, our families making ends meet is needed, because what we're seeing at the shelter, and again, what we're seeing in our community, I can't tell you how many phone calls we receive a week from our senior community who's on fixed incomes, who have been priced out. And so the more that we can advocate for keeping the landlords and park owners from increasing rent, whether that's using policies like rent control, and also looking for ways that we can bring livable wage jobs to our communities as well. These are all things that can help our families to prevent them from experiencing homelessness. And again, having an ecosystem of partners that are in this area to work together, anything that we can do to help prevent a family from becoming homeless, from experiencing homelessness, it's not as an uphill battle it is when a family's already in homeless, trying to get them back into housing. It's very difficult. And I will say, for the families that we're helping them get back into housing at our shelter, sometimes Often it's not in San Diego County anymore. We're helping them get into housing in Riverside County because it's cheaper to live there, and so families are being displaced. And so these are all issues that is taking place in our region. And so this is also, you know, we need policies that are going to support this and more affordable housing. We need more affordable housing in our area.
I think I can piggyback off of Jimmy's answer a little bit. I personally think about the work that we do as a viable policy solution. um, Amongst all the other things, right? Like there's infrastructure that needs to be built and established. You know, I loved your presentation. Over 100,000 units are needed to actually meet the need here, and then 23,000, I think it was, of for the extremely low income specifically. So there's like really obvious technical challenges that exist that have to be engaged on multiple levels, from the city to the county to the state. So there's that, and you know, the policy packages that incentivize this type of growth. And for me, working in pretty much all sectors, at this point, understanding how interconnected these problems are between sectors is so important. Because if someone has a home, or rather, I'll do the inverse, someone who doesn't have a home, who has a career and a career pathway to charting a path for their life, right? A career that they want to be in has high potential and opportunity of securing all of the other material needs, right? It's all about looking at that person holistically. And so we have to look at our system that way. And that's why businesses and foundations need to be a part of the solution to kick off some really innovative strategies. And I mean, there's so many different types of ways to help people feel empowered. Workforce is something that I'm passionate about, just being a business owner of a cooperative, and really bringing back the social element, the social connection, the social capital that comes with different ways, and incentivizing different ways to do business that really uplifts the entire community. Not simply establishing corporations inside communities that only marginally bring up the wealth, or not at all, really. So thinking kind of that long term and that deep and that connected to start planting seeds that create different types of ways people can live, not only survive, but thrive, is super important. So all the connections that need to go across these different agencies, I think we just have to examine them, examine the landscape, and see how deep we can go with our partnerships locally, because I think that's going to be the most powerful thing. And it's going to be kind of the engine that drives guaranteed income programs like ours, you know. Most importantly, programs like ours that really provide a platform for people to realize themselves as really the authors of their life. You know, it's important not to diminish that aspect of providing social support, because I think subsidies are needed. I think we need third party payment structures where organizations pay bills on behalf of people. But I also think there's a tremendous amount of, I said dignity before, but autonomy and freedom when we can build structures that really help build that in people. So long story short, I think we need to think about the technical pieces too, but also the really adaptive, kind of squishy human elements as we create these systems and make them work better for people.
Thank you so much. This has been great. And as we come up on towards the end of this webinar, I'd like everyone to start thinking about their questions if you have them for the panelists. And while you're doing that, I'd love to pass it over to Anne to kind of share their experience as a youth.
Okay, so hi, my name is Anne, and I just want to share my experience as a youth who has been through foster care, homelessness, just in general, and just a little like backstory. Um, my mom, my mom, I'm adopted now. Was dealing with mental health issues and wasn't really able to take care of us fully, me and my sister. And she didn't get the help that she needed, including medication, therapy, psychiatric needs, um, which caused us to be in and out of foster care. And she couldn't work because of that. So we were on welfare and getting food stamps and getting help from and help and donations from our friends and network, um, and just hearing these like insights and informations and things being done, it really warms my heart because it is something personal to me, and you know there is still so much more to be done, but I think we've made a lot of progress from just a few years ago. And yeah, that's it. Thank you.
Thank you, Anne, for sharing that. I see one of the questions in here for the panelists. What do you recommend? So someone said, my district does not offer students very much support with our students and families facing immediate homelessness. What do you recommend the school site do to help the student and faculty get immediately connected to a housing resource outside of something like a 5-day hotel voucher?
I I'll hop in a little bit because I think we're fortunate in North County where I feel like some of our school districts are doing the best that they can to connect the residents who have come forward with specific needs to different resources. But I know that some school districts have more resources than others. I know some school districts in North County that are operating on a very thin and limited support staff. And so, the cases are overwhelming and they're just doing the best that they can to connect to others. I think that for us at the shelter is we have a list of resources in our area, and we always try to ask those who call where they're currently located, and we can provide them whether it's through 211 or the Lines for Regional Solutions in North County, and the county also has resources based on what area region of the county that they're in. And so we try to do our best to provide the list of resources to those who apply to the shelter. And so I think utilizing county services like 211 really helps. And you can hopefully centralize, find something that's closest to you for a resource that is needed. But I do know that some regions have, they're being a little bit more proactive than others to provide these services. And I'm sure Jacqueline probably has a list of a lot of those resources.
Yeah, we'll also be sharing a full resource list at the end of this. But yeah, thanks so much for talking a bit more on that. If anyone else wants to hop in and add something, feel free to do so.
I don't have a solution, but I'll just piggyback on what Jimmy said. And yes, absolutely. The solution to someone's homelessness is generally not a 5-day voucher. People need housing, and we're back to that housing narrative. The solution to homelessness is housing. We don't have enough housing in this county. I was just looking at some statistics showing that the population in California is going down, which is good. But we haven't increased it. In the last 3 years, it's been going down. But in the 10 years before is when we hugely increased our population and did not increase the housing stock at the same rate. So that's sort of part of the problem, and that's what shoves up the rent prices, and that what makes the landlords able to choose. They're not going to choose someone that is difficult or has a dodgy credit in their house when they have 50 people looking for the same place. So that is a challenge. I think one of the things that we also do, other than the hotel voucher not being the automatic response, is, as Jimmy said, look for other programs that have more robust resources, but also really try to look at doubling folks up or going living with friends or family, if that's a possibility, just to get some stability and be able to have the time to do the search, whether it is resolving a healthcare issue, finding a job, finding a second job, just sort of trying to build that community support so that there's some strength for folks in their community. I think of that, the little nuances that we see sometimes. And we do have people that move, that decide they're moving to Idaho to reunite with family, et cetera, and support them with that move. The county actually has a program they implemented in Cooper, I think, and it's countywide, where there are resources for anybody that wants to reunite with family in other parts of the U.S. That we have resources to pay for the help with the transportation. The other thing that we are also trying to push, and this is housing patterns changed a little bit. Again, the population demographic is old, like me, getting old, and older people tend to live alone. And so that is one person in maybe a 2 or 3 bedroom house that is in our community. Coming up in the board of supervisors in the county on Tuesday is a small pilot program to try to pair seniors who have homes with vacancies with rental subsidies to have people in their house. So really looking at using the resources, maximizing the resources we have. So we have these folks getting old. Then COVID changed things. People want to live by themselves now. It was such an isolating thing that people don't want to share. They got used to being alone and changed some of their practices. So people really are looking one person in what could potentially be a shared housing. We are really trying to push, and the Regional Task Force on Homelessness has some contracts with this, with townspeople, the agency. And one of the programs that we have for people who are going to receive SSDI, which is about $1,050 a month, you cannot do anything with that, is shared housing, and really trying to get people to go back to the olden days when you flattered or shared a house with somebody, and the move away from the single family occupancy kind of housing that many folks like and feel comfortable with, but just can't afford these days.
Thank you. And I wanted to get into our next and final question that we got in the Q&A. And that question is, how can youth contribute to ending the housing and homelessness crisis? And also kind of what do you want youth to know about this issue in general?
I think that, local politics is key, and advocacy is very important. The more that our local officials, school officials, those in power hear these narratives and hear these stories, the more that we hope that it's going to propel to be proactive and really prioritize affordable housing, and really prioritize bringing in resources and services, and jobs, livable wage jobs, to help our families in need. But we need to continue to speak about it. And I think for me with the youth, the ability to mobilize and really organize and go to your local city council meetings, to your local school board meetings, and then also to the county board of supervisor meetings. They need to continue to hear about this over and over and over because it impacts us all, and it's impacting your peers. It's impacting your younger family members, the kids, the other kids in your community, and the more that we share, that it's impacting our local youth attending our local schools and our local families. I think that it's it's one of the biggest issues in our region. San Diego now is considered the highest place to live in the country, and we have a lot of very low income families. It's like what's going to happen to these families? They're going to continue to get displaced, and so it impacts our workforce, and it just it's going to increase the homelessness rate in our community. And so these are quality of life issues. These are humanity issues, and we got to continue to speak about it. And I really think that our youth have the power to be a big part of this solution, and a lot of it's going to be through advocacy and organizing.
Yeah, I would echo that again. I think one, I always talk about them because I am a mentor for this organization, Youth Will San Diego, Youth, that's WILL, Will. That is a very specific resource for youth in San Diego County, where some of you might already know about and be a part of. Very amazing, really amazing group. Just the amount of intelligence, the amount of energy around solving some of the solutions of today for youth and for their families. Doing it collectively in numbers is by far the best way, and really making sure that youth voice is not simply symbolic, right? Everybody likes to say that they care about youth voice, right? But doing it with folks who, one, are very savvy, organizations like this, and there are others too, that are really gathering the knowledge and meeting with elected officials on a regular basis. So empowering those organizations and really being involved in not only voicing concerns, but crafting the legislation or the policy you want to see, and taking that to your county supervisor, to your city council, because I think we're in a moment where there's actually room for that. There's a lot of us trying to figure out what the solutions are, and it's really meaningful to have fresh perspectives from youth who can bring those strategies to the table. And there are people who do want to listen. We're at the point where we really do need innovation and different solutions. So that's a great organization, Youth Will, and probably several others to be involved with, to really make sure that this issue is really contextualized from a youth perspective.
In this county, policy is driven by the city councils. Each city has a council that drives policy, and the county board of supervisors. And those really are the key for the government policies. And I assume it's the same with the school boards. You mentioned it, Jimmy, and they all have boards that provide guidance to their school districts. And I totally agree with Kia and Jimmy around advocacy, and not just asking for what you want or telling them what they should do, but those stories of people with lived experience and the success stories that have come from, and they're all complicated. None of them are single fixes, just the complexity of the solutions that people need to succeed.
And then I would just add to do everything you can as well, to position yourself or apply to be on the housing commissions and the planning commissions for each city, because a lot of times the way that things work, is that staff will put a report together and give it to one of the commissions, which are volunteer positions that you apply for. And then the mayor or the city council appoints you based on a vacant position. They have term limits. Those staff reports will go to the commission first. And then from the commission votes on it and makes a recommendation to the city council. And then the city council votes for it. And so even bringing advocacy to those commissions, because sometimes you go to those commissions and there's one or two people in the audience and things are getting passed all the time, or being denied. And so just being involved, what depending on what city you live in, subscribe to get notifications about when these meetings are taking place in the city you live in. And you will get the agenda and reports on what's taking place, and housing and developments are always on there. And there's always new policies, ordinances being passed as far as in regards to affordable housing, or new developments being developed in your city. And you want to know how many of those new units are going to be for affordable housing. And so these are things to advocate for. And one thing that I always share with youth as well is, when you're in the space of advocacy and you're going to a city council meeting, for a lot of our cities, we have maybe it's 4 council members and 1 mayor. So you need a majority vote to get anything passed. And a lot of times you do a lot of work to get 3 votes, because that's what you need to get things passed. And to be honest with you, like, I live in the city of Oceanside. Like, city council members get voted in with like 6,000 votes, right? And Oceanside is the 3rd biggest city in San Diego County. And so if you think about that, some of you have more followers on social media than that. And so it's, what can you do to put yourself in a position to also run for office, And so we do a lot of work to get 3 votes. I always tell people we should put that same amount of work to become one of the 3 votes. And then, we're able to get things passed, because I tell you, it's very disheartening to do a lot of organizing advocacy to get up there and you think you have the 3rd vote and then they just vote no, and it's like, and then you just feel, at times it could feel very deflating. And so I think it's also important for folks in our community, with the lived experiences, with the representation, and with a community-centered heart, to put themselves in a position to also be in office.
Thank you so much, everyone. I will pass it over to Anne to give kind of our thank you and closing remarks.
Okay, so that concludes our town hall on homelessness and the housing crisis. Thank you all for coming, and then also a special thank you to our panelists, Jacqueline McLean, Kia Pollard, and Jimmy Figueroa, for taking the time to be with us today and providing insightful information. On the next slide is our youth leader contact information if you have any questions, and then also a resource document that you could provide to someone experiencing the housing crisis, or even if you yourself are in need of resources. The link is also in the chat for easier access. Thank you everyone again for attending the Homelessness and Housing Crisis Town Hall, brought to you by the San Diego Liberal Youth Sector.
Thank you. Thank you so much, everyone, for joining.
Thank you, everyone.
Thank you.
And we'll be sure to send an email with these slides after to all of you. But thank you so much for taking the time to attend today.